All right, let's dive into one of the first big milestones in pregnancy, the Nuchal Translucency and Combined test. We're going to break down exactly what this test is, how it works, and maybe most importantly, what the results really mean for you.
You know, that first trimester? It is such a wild mix of pure excitement and, let's be honest, a ton of questions. You want solid information, you want some peace of mind, and you really want to feel good about the decisions you're making. So let's get you some of those clearer answers. And this really boils down to one central question that pretty much every expectant parent has. How can we get an early, reliable look at how our baby is doing? And that is so important. The whole point here isn't to create worry. No way. It's all about empowerment. It's about getting a clearer picture of your own unique journey so you can feel prepared and make the choices that are right for you. And that's where this specific tool comes in. It's an early and really gentle screening that for a lot of people has become a standard part of that first trimester experience.
Okay, so let's get the definition down, the NT and Combined test. Now, the first thing to know, and this is super important, is that it's a screening test, not a diagnostic one. And it happens in a really specific window, between 11 weeks and just under 14 weeks. Its whole job is to assess the chance of certain conditions. Of course, before we go any further, let's address the number one question on every parent's mind about any procedure, big or small. Is it safe for the baby? And the answer is a big, clear, reassuring yes. The whole thing is completely non-invasive, the ultrasound is just on the outside, and the blood test is a simple draw from your arm. There is absolutely no risk to the baby, which is what makes it such a valuable tool so early on. So, now that we know it's safe, you're probably wondering, how on earth does a simple scan and a blood test give us all this information? Well, let's get into the mechanics. Well, that's where the combined part of the name comes in. It's a two-part process. First, you've got the NT ultrasound. A specialist uses a really high-resolution machine to measure that tiny, fluid-filled space at the back of the baby's neck. Then, at the same time, there's the blood test, which checks the levels of two very specific pregnancy proteins. Think of it like putting together pieces of a puzzle. A computer algorithm takes the measurements from the scan, the protein levels from your blood, and then combines them with a couple other key factors, your age, and exactly how far along the pregnancy is. Putting all those pieces together creates one single personalized risk score. So, what exactly is this test screening for? It's looking at the chances for 3 of the most common chromosomal conditions: Down syndrome, also known as trisomy 21, as well as Edwards syndrome and Patau syndrome. Okay, so we've covered the what and the how, but what's it actually like to go to the appointment? What does it feel like? Let's walk through it step by step so you know exactly what to expect. Honestly, the whole process is really straightforward. It kicks off with that detailed ultrasound, then the blood draw, which, can often happen at the very same visit. After that, the lab does its magic behind the scenes. But the really key parts are the last two: having a clear chat about your results, and then, only if it's needed, planning any next steps. And I really want to hammer this point home. This entire process is designed to be supportive. It's meant to give you answers, not to cause anxiety. It's just a tool to give you knowledge so you feel in control. Which brings us to, maybe the most important part of this whole explainer: making sense of the results. When you get that information back, what does it actually mean? This is the single most important distinction to make. The NT and Combined test is a screening test. It does not give you a yes or no answer. What it gives you is a statistic, a risk, like 1 in 500 or 1 in 10,000. A diagnostic test is what gives you a definitive answer, and that's a different procedure entirely. So naturally, the biggest question is, what if the result indicates a higher chance? Well, the first thing to do is just take a breath. A high-risk result is not a diagnosis. It's simply a signal that it's time for more conversation and to look at your options. And you do have options. The very first step is always a good long chat with your doctor or midwife. From there, you might talk about other non-invasive screenings, or they might give you information about diagnostic tests. But here's the bottom line, and it's so important. You are in the driver's seat. The choice about what to do next, if anything, is always yours. You know, this quote just perfectly captures the spirit of this test. Because for the vast majority of people, the result is a low-risk number that just provides this incredible wave of reassurance right when you need it most. It turns those fuzzy worries into something concrete and comforting. And really, that's the absolute best way to look at this. It's a tool. It's one of the first truly personalized pieces of information you get on your pregnancy journey. There's no passing or failing. It's just about understanding and getting yourself ready to make the best decisions for you and your family. So we'll end with this thought to leave you with. In a journey that can feel so full of unknowns, what's the value of getting clear early information? This test is really just a first step, a way to start turning those big questions into answers so you can navigate the path ahead with a little more confidence and a whole lot more peace of mind.